So in the posterior part of Normabasalis we get the foramen magnum, and just anterolateral to this foramen you are getting the occipital condyles. These are occipital condyles. Just behind the occipital condyles we are get the condylar fossa. Sometimes foramen, there is a foramen present in these condylar fossa. These are known as condylar canals. And just anterior to the condyles you are getting there is a foramen hypoglossal canal here. You are seeing the hypoglossal canal. And between the jugular process of occipital bone and posterior border of petrous part of temporal bone, this is the jugular foramen. This is the jugular foramen, and this is the jugular fossa. This is jugular fossa, this is jugular foramen. And you are seeing this is styloid process, and just behind the styloid process you are getting the stylomastoid foramen. So we have remembered that the facial nerve coming out through stylomastoid foramen, and the stylomastoid artery, which is the branch of posterior auricular artery, also going into the medullary cavity through this foramen. So just for revision: foramen magnum, occipital condyles, hypoglossal canal, jugular foramen, jugular fossa, styloid process, and stylomastoid foramen. And behind you get the occipital crest, external occipital crest, external occipital protuberance, and nuchal lines. And just anterior to the anterior margin of foramen magnum you get the pharyngeal tubercle. This is a small elevation you are seeing here. This is the pharyngeal tubercle. So I have already told you that there are 5 structures passing through this jugular foramen: anterior to posterior, first inferior petrosal sinus, then glossopharyngeal nerve, then vagus nerve, then accessory nerve, then sigmoid sinus. When inferior petrosal sinus joins the sigmoid sinus just inferior to the jugular foramen, it forms the internal jugular vein. So just you are seeing between the part of bone which separates the jugular fossa and carotid canal, you are seeing a small foramina. This is tympanic canaliculus. Through this tympanic canaliculus, tympanic branch of glossopharyngeal nerve enter into the medullary cavity. There is also one foramen present on the lateral wall of jugular fossa. This foramen leads into a canal known as mastoid canaliculus, through which auricular branch of vagus nerve pass into and supplies the external ear. In this picture you are seeing this is jugular fossa, this is carotid canal, and between the bar of bone present between these two you are seeing a small foramen. This is tympanic canaliculus, and this just in the lateral you are seeing the mastoid canaliculus, through which the auricular branch of vagus nerve coming out and supply the external ear. In this picture also you are seeing same tympanic canaliculus and mastoid canaliculus. So students, this is all about the Normabasalis. So thank you.